Hello friends, welcome back to Cortex YouTube channel. In this video, I am going to talk about TB preventive therapy, that is TPT. Why it is so important? Because more than quarter of world population, is infected with TB, tuberculosis bacteria. So see, there is two words. One is infection with tuberculosis bacteria, and there is tuberculosis disease. See, infection and disease is different. Okay, not all infected patients will have tuberculosis disease. So there is maybe many patients may be infected with TB bacteria, but they all of them may not go to have tuberculosis disease. So there is, we don't know who exactly will go for tuberculosis disease. Okay, there are so many risk factors like HIV infection, immunocompromised states and all, but we don't know exactly who will go for this disease from infection, or we can call it as latent infection. So we want to target these people, those who are at high risk of developing disease, and give them this preventive therapy. We know that they are going to have disease in future, so we want to prevent that tuberculosis disease in those population. So how to identify this infected patients? See, as of now, there is no gold standard test for the detection of true infection. Okay, your tuberculin sensitivity test and IGRA test, they will only tell about immune reaction to the TB, which may be previous exposure. Okay, that immune reaction may be because of previous exposure, so it will not tell about the true infection. But still, we can use these tests and cutoffs based on the risks that the patient is having and provide TPT. So so how to identify infection? As of now, we can have two tests, that is tuberculin sensitivity test TST and IGRA test. Okay, these two tests will help me to identify infected individuals. Okay, so how to do this TST tuberculin test? We use Montague's method. So what is this Montague's method? We use 5 units of PPD. We inject this intradermally in volar aspect of forearm. Okay, and we read, it is read at 48 to 72 hours after the injection. So what we have to see is induration, not the erythema. So induration, not erythema. Note this point. Okay, there is redness, so you should not consider that redness. You should only consider induration. What we have to see is we have to measure the transverse diameter of the induration, and we have to document it, and we have to see whether the patient is having risk and whether it is passing above the cutoff. Okay, so after this test, we have to see whether it is fulfilling the cutoffs. So what is this cutoffs are based on the risks of the patient. Okay, so in some patients we can consider more than 5 mm is cutoff positive. In some patients we can consider more than 10 mm as positive. So what are those patients in whom 5 mm is enough, more than 5 mm is enough to give TPT? So you can remember by these are rich people. Okay, these are rich. So rich is the mnemonic here, where R stands for renal failure or other medical conditions like silicosis, renal failure patients, or medical risk factors like silicosis. Okay, and I stands for immunosuppressed patients. So who are these immunosuppressed patients? These are those who are on steroids, or those who are having organ transplantation recipients. So in these patients, even if it is more than 5 mm, you can consider for TPT. So or C stands for contacts of infectious pulmonary tuberculosis, and H stands for HIV infection. So in this rich patients, even if it is more than 5 mm in duration, we can provide TPT, that is tuberculosis preventive therapy. So in whom we consider more than 10 mm as positive. So this can be remembered by rich pick. So complete mnemonic is rich pick. Pick here stands for, where P stands for personals from high risk settings. What are these high risk settings? Microbiology lab, micro labs, or nursing homes, okay, or other healthcare facilities. So persons from micro labs, microbiological labs, or nursing homes from other healthcare facility providers, they can be at high. If more than 10 mm in those patients, we can go for TPT. Next, I stands for recent immigrants. What is this? Immigrants from the tuberculosis endemic area. So recent immigrants means less than 5 years. And C stands for children less than 5 years. Okay, children less than 5 years, you can consider more than 10 mm as positive. One more I forgot here to mention. It is what is this? One more I. It is injection drug users. Okay, it is injection drug user. So in these patients, if it is more than 10 mm, you can give TPT, tuberculosis preventive therapy. So you know the indications now. So these tests, TST and IGRA test, are not necessary in certain conditions. So what are those conditions? In infants and children who are in contact with active infectious TB, patients, or HIV infected individuals, those who are more than 1 year patients, HIV positive patients more than 1 year in contact with infectious TB patients, we can provide TPT without even testing for the TST. Obviously testing is very necessary. In this condition it may not be necessary. Okay, you can directly go for TPT. So you know the indications, you know what test to be used. Now you should know what are the drugs available for TPT. So drugs available for TPT are isoniazid, rifampin, or rifapentin. Okay, so these are the drugs which are available for TPT. So how to give isoniazid? If you are using isoniazid alone in adults, the dose is 300 mg per day. Every day they have to take 300 mg for around 6 to 9 months. Okay, 6 to 9 months they have to take. If you are giving rifampin, the dose is 10 mg per kg per day for only 4 months. Isn't it good? They have to take only for 4 months. Okay, but if you are giving combinations of the both rifampin and isoniazid plus rifampin, so you can give only, the dose is same here, you can give only for 3 months. It's good. Okay, here also daily doses. Okay, there are only weekly doses. Okay, there are weekly doses, but here drug is rifapentin, which plus isoniazid. Here you have to use the dose 900 mg. 900 mg plus 900 mg. This is weekly dose. Weekly for only 3 months. It's good for 12 weeks. Only weekly, the patient has to take only weekly tablets and for only 12 weeks or 3 months. You can also use a daily regimen for 28 days. Same drugs. Okay, here the dose is different. 300 mg isoniazid plus 600 mg rifampicin. Here it is daily. Here daily for 28 days. So these are the regimens used for TPT. Okay, isoniazid 300 mg daily for 6 to 9 months, rifampin 10 mg per kg per day for 4 months. If you are using both combination of isoniazid plus rifampin, the doses remain same, but duration is only for 3 months. And if you are giving, if the patient wants to take for only less period of time and less doses, you can use rifampicin and isoniazid in both 900 mg dose, but weekly. Here it is weekly, mark here it is weekly. Rest other regimens are daily. So only weekly regimen is rifampicin plus isoniazid, that is for only 3 months. And one more regimen is only 28 days regimen, that is only 1 month regimen, but the patient has to take for daily rifampicin plus isoniazid 300 plus 600 mg daily for 28 days. So these are the regimens. So when you are giving these drugs, you should know the possible side effects. So when you are giving isoniazid can be represented as INH. No. So when isoniazid you are giving, you have to look for these side effects. What are the side effects? Isoniazid and INH is itself a mnemonic to remember the side effects of INH. So I stands for immune reactions. So what are these immune reactions? Patient can present with fever, rash, okay, joint pain and all. SLE-like features. Okay, you remember SHIP, one of the drug is INH there in SHIP. Okay, one more, N stands for neuropathy, peripheral neuropathy. In rare conditions, nephrotoxicity can also happen. Third one is H stands for obviously hepatotoxicity. So these are the side effects, possible side effects that you have to remember whenever you are giving isoniazid to the patients. So one more drug that you are giving is rifampin. So rifampin and rifampicin both are of same class, but rifampicin is more longer acting than the rifampin. So side effects resembles the same. So how to remember? Rifampin is itself a mnemonic to remember the rifampin side effects, where I stands for red orange discoloration of the body fluids, red orange discoloration, and I stands for interactions, because these drugs induce CYP 450 enzymes. So interactions are bound to happen, especially with the OCPs and other drugs, and protease inhibitors drugs. Okay, and F stands for flu-like symptoms, fever, myalgia, arthralgia, like flu-like symptoms. A stands for abdominal symptoms like nausea, vomiting. Okay, abdominal symptoms. M stands for myelosuppression. So patients will have anemia, thrombocytopenia and all. P stands for pseudomembranous colitis. And one more, I stands for interstitial nephritis. Very rare, but can happen. Interstitial nephritis can happen. So other drugs which causes interstitial nephritis are NSAIDs and PPIs. PPIs are known to cause interstitial nephritis. And N stands for nausea and hepatotoxicity. So this is about rifampin and its side effects, and it is about TB preventive therapy. In quick revision, TB preventive therapy, how to check for infection. It is indicated for infected individuals. How to check for infection? Tuberculosis sensitivity test and IGRA test. So you have to remember this positive cutoffs, and if the patient satisfies the positive cutoffs, you have to go for TB preventive therapy, TPT. We can use isoniazid, rifampin, or rifampicin, or combination of these drugs. Okay, the doses has to be remembered. Shortest regimen is 28 days. All the regimens are daily regimens, except for this rifampicin plus isoniazid 900 mg weekly regimens. So that is given for only 3 months. So this is about TB preventive therapy. If you find this video useful, please share among your friends and juniors, colleagues. Thank you.